Have you noticed that a loved one has started showing small but concerning changes over the past year? Maybe they seem quieter, move more slowly, or forget things more often. At first, these changes might not seem like a big deal, just part of aging. But what if they are actually early warning signs that their body is entering its final stage of life? Many people assume that death in old age happens suddenly, but the truth is that the body often sends quiet warnings months, even a year in advance. The problem is, most families miss these signs because they start off small. Only later, looking back, do they realize that the clues were there all along. But by then, it is too late to prepare, too late to make those last memories count. But you can change that. In this video, we will talk about 5 key signs that often appear in the final year of life. Some of them might be things you have noticed but brushed off as just aging. Others might be changes that seem minor but actually signal the body's gradual decline. Recognizing these signs early gives you the opportunity to provide better care, cherish meaningful moments, and most importantly, ensure that your loved one's final stage of life is filled with comfort, dignity, and peace. Why this is important? Because when you recognize these signs early, you can mentally prepare for what is ahead, rather than being caught off guard. Improve their quality of life by ensuring they receive the right care and support. Create meaningful memories instead of looking back with regret. Make important decisions in advance, avoiding rushed or stressful choices. Understanding these signs is not about fearing death. It is about being prepared for it. When you know what to expect, you can focus on what truly matters. Spending time with your loved one, making them feel valued, and ensuring their final months are filled with love and peace. Stay with us until the end, because these 5 signs can help you navigate this journey with clarity and compassion. Now let's get started. Sign number 1, declining ability to care for oneself. One of the earliest and most significant signs that an elderly person may be approaching the final stage of life is a noticeable decline in their ability to care for themselves. At first, the changes may seem minor. They may take longer to get dressed, forget to brush their hair, or occasionally need assistance standing up. Over time, these small difficulties can become more frequent, signaling that their body is gradually losing strength and coordination. How it begins. The early signs of declining self-care abilities often include forgetting to change clothes or maintain basic hygiene, struggling with buttons, zippers, or shoelaces, difficulty preparing meals or remembering to eat. As time progresses, these challenges become more severe. Increased difficulty with mobility, such as standing or walking without assistance. Neglecting personal hygiene, like skipping showers or forgetting to brush their teeth. Unintentional weight loss due to forgetting to eat or lacking the strength to prepare food. When an elderly person begins to struggle with daily activities, it is often a sign that their physical and cognitive functions are weakening, indicating a significant shift in their overall health. Why does this happen? The loss of independence does not happen suddenly. It is caused by a combination of factors, including muscle weakness and fatigue. The natural aging process leads to muscle loss and reduced strength, making simple movements more difficult. The body may also begin to conserve energy, causing exhaustion even after minimal effort. Cognitive decline, forgetfulness, can cause them to skip important tasks, such as bathing or taking medication. They may lose awareness of time, making it harder to maintain routines. Joint pain and limited mobility conditions like arthritis or osteoporosis can make movement painful. Over time, they may become less active, leading to further loss of strength. How families can provide support. Encourage independence while offering assistance when needed. Modify their environment for safety, such as installing grab bars and using adaptive clothing. Prioritize comfort over perfection, allowing them to do what they can without pressure. When a loved one begins losing the ability to care for themselves, it is more than just a physical challenge. It is a sign that their body is slowing down, and this is the time to shift the focus from independence to ensuring dignity, safety, and comfort. Now let's move on to sign number 2, memory and cognitive decline. Another clear sign that an elderly person may be entering the final stage of life is a decline in memory and cognitive function. At first, it may seem like ordinary forgetfulness, misplacing objects, struggling to recall a name, or taking longer to follow conversations. However, as the decline progresses, these lapses become more frequent and severe, affecting their ability to engage with daily life. How it begins. Memory loss and cognitive decline often appear in subtle ways, forgetting appointments, important dates, or recent conversations, repeating the same questions within short periods, struggling to follow simple instructions or complete basic tasks. Over time, these difficulties may worsen, forgetting names of close family members or familiar places, getting lost, even in their own home or neighborhood, confusion about time, such as mistaking morning for evening or forgetting what day it is. When these changes become noticeable, it is a sign that the brain, like the rest of the body, is gradually slowing down. Why does this happen? Cognitive decline in the final stage of life is often linked to multiple factors. 1. Reduced blood flow to the brain. As circulation weakens, the brain receives less oxygen and nutrients, leading to slower thinking and memory loss. 2. Neurological deterioration. The brain naturally loses neurons over time, but in the later stages of life, this process accelerates. Some may experience symptoms of dementia or Alzheimer's, even without an official diagnosis. 3. Fatigue and energy conservation. As the body focuses on essential functions, less energy is directed toward cognitive processes, causing increased confusion. 4. Emotional and psychological factors. Anxiety, depression, and social withdrawal can worsen cognitive decline as the brain is less stimulated. How families can provide support. Watching a loved one struggle with memory can be painful, but there are ways to help. Maintain a consistent routine to create familiarity and reduce confusion. Use simple reminders, visual cues, or labels to help them stay oriented. Avoid correcting or pressuring them to remember. Focus on comforting rather than challenging. Engage them in meaningful interactions, such as listening to music, looking at old photos, or sharing simple conversations. Cognitive decline is not just about memory loss. It is a sign that the brain and body are preparing for the final transition. The best thing you can do is create a calm, supportive environment where they feel safe and loved. Now let's move on to sign number 3, unexplained weight loss. A significant but often overlooked sign that an elderly person may be approaching the final stage of life is unexplained weight loss. At first, the changes may be subtle. Their clothes may seem looser, they may eat less, or their appetite may fade. Many families dismiss this as a natural part of aging, but when weight loss happens without any clear reason, it often means the body's no longer processing nutrients efficiently. How it begins. The early signs of unexplained weight loss include a gradual reduction in appetite or disinterest in food, clothes appearing baggy even though their diet has not changed, a weaker, frailer appearance with less energy for daily activities. As weight loss progresses, more serious symptoms may appear, increased difficulty in recovering from minor illnesses or infections, muscle loss, making movement harder and increasing fall risks, a general sense of fatigue as if their body is running on less energy. When a person loses weight without trying, it is often a sign that their body is slowing down and conserving energy for essential functions. Why does this happen? Unexplained weight loss in the final stage of life is caused by several physiological and medical factors. 1. Reduced nutrient absorption. As digestion slows down, the body becomes less efficient at absorbing nutrients, even when food intake remains the same. 2. Loss of muscle mass, sarcopenia. The body naturally breaks down muscle tissue for energy, leading to visible frailty. 3. Changes in metabolism. In the later stages of life, the body no longer prioritizes long-term energy storage, leading to weight loss. 4. Underlying medical conditions. Chronic illnesses such as cancer, heart disease, or kidney failure often cause weight loss before other symptoms become noticeable. 5. Psychological and emotional factors. Depression, grief, and emotional withdrawal can reduce appetite and motivation to eat. How families can provide support. It can be concerning to see a loved one lose weight unexpectedly, but forcing food is not always the answer. Instead, focus on making eating more enjoyable and stress-free. Encourage smaller, more frequent meals with soft, high-nutrient foods like smoothies, soups, and yogurt. Offer favorite foods to make meals more appealing, even if they eat less than usual. Keep them hydrated with small sips of water, herbal tea, or electrolyte drinks. Avoid pressuring them to eat large portions, which can create discomfort. Monitor for signs of weakness or fatigue, and consult a doctor if weight loss becomes extreme. Unexplained weight loss is not just about eating less. It is often the body's way of preparing for its final stage. Instead of focusing on restoring weight, the best approach is to prioritize comfort, hydration, and emotional well-being. Now let's move on to sign number 4, loss of communication and social interaction. As the body weakens in the final stage of life, many elderly individuals begin to withdraw from conversations and social interactions. You may notice that they talk less, avoid eye contact, or seem uninterested in activities they once enjoyed. At first, these changes may appear subtle, but over time they can become more pronounced. How it begins. The early signs of social withdrawal may include speaking less frequently or responding with short, vague answers, losing interest in hobbies, television, or reading, spending more time alone, even when family members are present. As their condition progresses, more significant changes may occur. Struggling to follow conversations or appearing distracted, showing little emotional reaction to news or family events, sleeping more and interacting less, even when awake. When a person begins to disconnect from their surroundings, it is often a sign that their mind and body are preparing for the final transition. Why does this happen? Social withdrawal is not simply a matter of choice. It is often caused by physical and neurological factors. 1. Cognitive overload. As memory and processing speed decline, conversations become mentally exhausting, making them withdraw rather than struggle to keep up. 2. Fatigue and energy conservation. The body prioritizes essential functions, causing a natural decline in verbal and social engagement. 3. Hearing and vision decline. Many elderly individuals struggle to hear clearly, making social interactions frustrating. They may withdraw because they do not want to ask others to repeat themselves. 4. Emotional and psychological factors. Some may begin detaching from the world, preparing themselves emotionally for what is ahead. Depression or feelings of isolation can worsen withdrawal, even if family members are present. How families can provide support. Social withdrawal can be painful to witness, but there are ways to help your loved one feel connected and valued. Create a calm, pressure-free environment where they can engage at their own pace. Use nonverbal communication, such as gentle touch, smiles, or simply sitting with them. Play familiar music or read to them, even if they do not respond. Avoid forcing conversation. Let them speak when they feel comfortable. Reassure them with your presence rather than expecting interaction. Social withdrawal is not a sign of rejection. It is often a natural part of the process as the body and mind shift toward rest. Simply being there, offering quiet companionship, and providing comfort can mean more than words ever could. Now let's move on to sign number 5, changes in breathing or circulation. One of the most noticeable physical changes in the final stage of life is a shift in breathing patterns and circulation. These changes often happen gradually, but as the body slows down, they become more obvious. Many families find this stage concerning because breathing patterns can appear irregular or labored, making their loved one seem uncomfortable. However, these shifts are often part of the body's natural transition rather than a sign of distress. How it begins. Early signs of changes in breathing and circulation may include breathing becoming slower or more shallow, feeling cold more often, especially in the hands and feet, a slight bluish or pale tint to the skin, particularly around the fingers, toes, and lips. As the body continues to slow down, more noticeable symptoms may appear. Periods of irregular breathing, where they stop for a few seconds before resuming. Gurgling or rattling sounds when breathing, caused by a buildup of mucus in the throat, increased fatigue and difficulty speaking due to shortness of breath. These changes do not necessarily mean discomfort. They are often signs that the body is gradually conserving energy and reducing non-essential functions. Why does this happen? Breathing and circulation changes in the final stage of life occur due to several physiological factors. 1. Weakened heart function. As the heart weakens, it pumps blood less efficiently, leading to poor circulation in the extremities. This is why hands, feet, and even the nose and ears may feel cold or appear discolored. 2. Reduced oxygen levels. The lungs begin to slow their function, causing breathing to become irregular. Oxygen levels drop, making the person feel tired and less responsive. 3. Fluid buildup in the lungs. Some individuals develop a rattling sound when breathing, known as the death rattle. This happens because they are no longer able to clear mucus from their throat, but it does not always cause discomfort. Number 4, the body's natural slowdown. The body is focusing its remaining energy on essential functions, causing less need for deep breathing or movement. How families can provide support. Although these changes can seem unsettling, there are ways to provide comfort. Keep the room cool and airy to help ease breathing. Use pillows to elevate their heads slightly if breathing seems difficult. Offer small sips of water or keep their lips moist to prevent dryness. Play soft, calming music or speak gently to reassure them. Avoid panic or distress. Stay calm and let them rest peacefully. Changes in breathing and circulation are a natural part of the final transition. The best thing you can do is create a peaceful, comforting environment, ensuring your loved one feels secure and supported in their final moments. Conclusion. As we reach the end of this discussion, it is important to reflect on the 5 key signs that may indicate an elderly loved one is approaching the final stage of life. These signs often appear gradually, sometimes months or even a year before death, giving families an opportunity to prepare both emotionally and practically. Recap of the 5 signs. 1. Declining ability to care for oneself. Struggling with daily activities such as dressing, bathing, and eating is often an early sign that the body's losing strength and energy. 2. Memory and cognitive decline. Increasing forgetfulness, confusion, and difficulty recognizing loved ones may indicate that the brain is slowing down, making mental processing more difficult. 3. Unexplained weight loss. A sudden loss of appetite or muscle mass can signal that the body's no longer absorbing nutrients efficiently, prioritizing energy conservation over long-term survival. 4. Loss of communication and social interaction. Many elderly individuals withdraw from conversations, show less emotional engagement, and spend more time alone as their energy diminishes. 5. Changes in breathing or circulation. Irregular breathing patterns, cold hands and feet, and reduced oxygen flow are clear indicators that the body is preparing for its final transition. Recognizing these signs early allows families to make informed decisions about care and support while ensuring their loved ones' final days are filled with dignity and peace. Why awareness matters. Many people avoid thinking about the final stages of life because it is painful and difficult to accept. However, understanding these changes is not about fearing death. It is about being better prepared so that you can provide the best possible care and emotional support. When you recognize these signs, you can shift the focus from prolonging life to ensuring comfort and quality of life. Have meaningful conversations while there is still time. Make necessary adjustments to their living space to prevent discomfort or accidents. Mentally prepare yourself and your family for what is ahead, reducing stress and regret. What you can do now. If you have noticed any of these signs in a loved one, now is the time to be present, offer reassurance, and focus on making their days as peaceful as possible. Spend more time with them. Even if they do not speak much, your presence matters. Ensure they feel comfortable, cared for, and respected. Take moments to express love, appreciation, and gratitude. Even small gestures can make a difference. A final message. The end of life is a journey that everyone must go through, but no one should have to face it alone. While we cannot change the inevitable, we can make sure that those we love feel safe, valued, and surrounded by care. By recognizing the signs, preparing in advance, and offering compassionate support, we can help ensure that their final moments are filled with peace, comfort, and love. Thank you for watching this video. If you found this information helpful, feel free to share your thoughts in the comments and let us know how this has helped you or someone you love.